when you said, when you said most people wouldn't know, I mean, I think most consumers definitely wouldn't know. But if you're a nurse kind of practicing on the side, right, as it seems to be the case for this nurse in Illinois, would you know that you weren't getting real Botox?
You absolutely should know.
Yeah.
Absolutely.
Yeah.
Yeah. I mean, first of all, you should know you're ordering it illegally in the first place.
Yeah.
And second of all, you would look at that box. If you were using real Botox all day and then got this box in the mail and weren't expecting fake Botox, you would know because it just looks different. I mean, especially the 150 part. This is Med Spa Mayhem, the podcast all about the chaotic world of medical aesthetics. From Botox to lasers to IV bars, learn how to tell real versus fake, legal versus illegal, and safe versus potentially deadly. Hear the crazy stories inside the med spa world and find out what questions to ask and how to spot the people cutting corners. I'm your host, Dr. Kate D. Together, we explore the wild west of medicine that is the aesthetics industry. Have you read the recent headlines about fake Botox leading to botulism and sending people to the hospital? The number of people sickened is now up to 22 in 11 different states. If you haven't already listened to episode 4 on fake Botox, this episode may make you go back and listen now. Today, attorney Becky Shao and I discuss how and why this happened, and how you can avoid any place or person that might be illegally buying fake Botox. Hi, this is Dr. Kate D, and I'm here today to talk about Botox in the news, or rather, Faux-Tox, that's been capturing the headlines over the last 2 weeks. And I'm here with Becky Shao, who is a lawyer and kind of understands these things, maybe on the law side a little better than I do. She went to college at UCLA and went to Emory University Law School. Becky, thanks so much for being here today.
Hey, Kate, thanks for having me.
So can you tell our listeners exactly, what kind of law that you do and why you know anything about this stuff?
So I am, I guess the easiest way to put it is a life sciences and medical device regulatory attorney. My background, I started out dealing with healthcare fraud and abuse, and then since moved in-house to a med device company, followed by a pharma company, and now work as global regulatory counsel for a biotech company. So I guess, just regulatory attorney is the easiest way to put it.
So basically the ins and outs and legalities of medical, like pharmaceuticals and devices and things like that.
Yeah, and
Okay.
anything that kind of sits under the umbrella of the Food, Drug, and Cosmetics Act and all the regulations that come with that. And then the corresponding acts in different countries, in the EU, in Japan, in China. That's kind of my current role.
Cool. So all that's really helpful in trying to understand how it is people are buying fake Botox and leading to people being in the hospital from it, right? So all that regulation, I assume, to try to prevent anybody being injured by these kinds of drugs.
Yeah, absolutely. I mean, here in the US, the FDA's job is to make sure that drugs and devices for human use and for animal use actually are safe and effective. And so, jurisdiction over the drug or the device itself, of course, there's, states are kind of responsible for public health in general. And so oftentimes these issues kind of come within an overlapping set of jurisdictions between different agencies.
Yeah. So, well, hopefully that all sounds complex, but you can simplify it for us when we talk about this. So basically in the headlines about over the last 2 weeks, there have been 19 people sickened with botulism, I believe 9 of whom were actually hospitalized and had difficulty breathing because of fake Botox. And this has happened in 9 different states. So it's not just one provider. It's actually many providers. And I really wanted to do a discussion about this and explain to people why this is happening and how to avoid it. Because we actually talked in episode 4 about fake Botox, and but it has never made the headlines the way it has over the last couple of weeks. So I want to explain to people how it's happening and ultimately, the ins and outs of it, but ultimately how to avoid that.
Mm-hmm.
It's actually been kind of a crazy week in the news. Here in Seattle, there was a plastic surgeon who was in the news because he was found guilty of pressuring his patients into signing agreements so they couldn't post bad reviews. They couldn't sue him. It was just, really bad. And then there was just over the last couple days, the New York Times and the Seattle Times, I'm sure some other papers ran this, cases of HIV that came from a New Mexico medical spa. Interestingly enough, that incident actually happened back in 2018. And that person did go to jail for spreading HIV around. And you can read about that in Med Spa Mayhem because that happened long enough ago that's actually in my book. But I really wanted to focus today on Faux-Tox and what the deal is with that. So cases have been detected in Colorado, Florida, Illinois, Kentucky, Nebraska, New Jersey, New York, Tennessee, and my state of Washington.
Mm-hmm.
As far as we know, as of today, there haven't been any deaths. And when the person, at least I believe the person in Illinois, when she was arrested, they actually took a picture of the fake Botox. And that actually was published on NBC News this last week.
Oh, so
and it was clearly fake.
They arrested someone
Sorry.
in Illinois. Sorry, I didn't mean to cut you off.
Well, okay, I guess I don't know for sure if she's actually been arrested, but this was a nurse who was practicing kind of as a side gig, not as her main job.
Mm-hmm.
She was, quote, performing work outside her authority. And we don't really, as I've talked about many times on this podcast, there are many people out there doing this as a side gig and getting Botox illegally one way or another. Nurses can't buy Botox. So one way to get it is to order fake Botox off the internet, which is really, really easy to do.
Mm-hmm.
If you Google Botox, you can buy almost anything on Alibaba, which is basically the Chinese equivalent of Amazon.com.
That's interesting. The Alibaba one's interesting to me because, I think that this is one of those interesting areas where the manufacturer has a vested interest in keeping up, with their brand and the quality of their brand. And I always thought it was difficult to detect counterfeit and that it was difficult to monitor and enforce. But if you can just go on Alibaba and find it, I'm surprised that they haven't tried to find a way to shut it down. I'm not saying that they haven't, but I guess I think you know more about this area than I do. I mean,
well, I don't know. I just know that counterfeits pop up the moment you get rid of one. 3 more pop up,
yes.
And that's true on Amazon too. If you look at, many, many products are spoofed on Amazon, and it's really hard to tell, which supplier you're getting it from when you order it on Amazon, and like whether it's the real thing or a counterfeit thing. So I think that's really, it's difficult. But I did look at on the NBC News article, they took a picture of this box of fake Botox, and since I use Botox all the time, I know it was fake. It first of all, it was 150 units, and Botox doesn't come in 150 units. It comes as 100 or 50s. It doesn't come in 150. And then there were some other things about the box that didn't look right. The colors weren't quite right, and it didn't say the right toxin. So, Botox is actually called onabotulinum toxin A.
Mm-hmm.
And well, aren't you glad you don't have to say that every day, right? But it didn't have that on it. It said something different on it. So, it looked fake to me, but most people wouldn't necessarily know. And certainly if you were a patient in the room, you'd have to know that that 150 wasn't right.
Well, I was actually going to
But-
ask you this when you said most people wouldn't know. I mean, I think most consumers definitely wouldn't know. But if you're a nurse kind of practicing on the side, right, as it seems to be the case for this nurse in Illinois, would you know that you weren't getting real Botox?
You absolutely should know.
Yeah.
Absolutely.
Yeah.
Yeah. I mean, first of all, you should know you're ordering it illegally in the first place.
Yeah.
And second of all, you would look at that box. If you were using real Botox all day and then got this box in the mail and weren't expecting fake Botox, you would know because it just looks different. I mean, especially the 150 part. I wanted to just ask you, I know that you're not necessarily an expert in this, but there are many ways that Allergan, the maker of Botox, tries to make it not copyable. So like one thing I do know is that like real Botox has a hologram on it. So if you don't see the hologram, that's not real. I'm assuming they like have a big budget to sue people who are importing Botox illegally and stuff. Can you comment on that?
Well, I think that every pharma company and device manufacturer, like I said, they do have an interest, right, in keeping an eye on the quality of their product from both a branding perspective. And I think that a lot of these companies do care about patient safety. I think, yes, to a certain extent, you would have a budget. And I think that the difficulty is, I think most of the time, what they become aware of is, for example, if someone's trying to import a product from a country where it's cheaper, right? And then they go to the sales rep and say, hey, I can get this in Canada why is this so much cheaper in Canada? Then the sales rep will find someone in the company to say, like, let's shut this down. This distributor in Canada is trying to import into New York. But oftentimes it's difficult to detect, even if you're the manufacturer of actual counterfeiting, right? That those are back channels that unless someone comes across it, I think it would be difficult to detect. Do they scour the internet? Yes, I think they do. But I think we have this issue at the company that I work at. Our devices are sold on eBay, on Amazon, and there's only actually so much you can do. Sometimes they're from, for example, people in other countries that are trying to sell the device. It's a lot more difficult to sue someone in China, for example, than it is to sue someone here in the States. There's just a lot of considerations, and I think it's difficult to police and enforce, even if you have the resources of a big manufacturer like Allergan or
Yeah.
AbbVie.
It would seem that, okay, so for our listeners, there are basically two different ways to buy Botox or other toxins illegally, right? So one is to buy counterfeit Botox, and that's what we're talking about here. That clearly wasn't real Botox. It was maybe cruder, not pure, or in a way higher concentration than was expected. And all these people got botulism from it, which you would never get from real Botox because we're using these teeny tiny little amounts.
Mm-hmm.
And toxin that's used for laboratory studies or someone somehow got a hold of some and stuck it in a bunch of vials and sold it, you don't know how much is in there, and chances are it's way too high a concentration, and that can kill you, right?
Mm-hmm.
So that's that's counterfeit product. That's
fake, fake product.
One way. The other way that's I don't even know if it's more common, but also very common, is the illegal importation from other countries. And that is, maybe one step up safety wise, just because it's probably real Botox or Dysport or whatever, but it's being illegally imported. And I would argue that that's also very dangerous because you don't know where it's been. You don't know how it's been stored. You don't know what expiration date is on it. And anybody cutting corners to illegally import it, you can't, I wouldn't trust them. But the other thing is, if there's anything that's an issue with your treatment, then you have no recourse. So, that person who illegally obtained that, let's say you have a problem. You can't go to Allergan and say, hey, there was a problem with this vial because you illegally imported it or purchased it in some way. And this came up in another episode where, this was an esthetician who owned the spa and was buying Botox from another spa who was reselling it to her because she couldn't buy it on her own. And there was a bad batch. And all these, this was during a time where there was, bad batches. And they couldn't do anything about that. And they couldn't call Allergan. And they had bought 100 vials. And so that this person was being pressured into using it, even though she knew it was kind of a bad batch. So it's really a problem as a consumer, not that you're going to necessarily die from it, but you're not getting what you thought you were paying for.
Yeah.
For sure.
Wait, so you're saying that you know of someone who couldn't get access directly through the manufacturer and purchased it from another spa, what she thought was real
that
Botox.
happens all the time.
Oh,
that happens all the time. And people also will share purchasing. So they can't, there are tiers like frequent flyer miles. There's tiers for purchasing. Yep. And maybe they don't buy that much, but they work together with another spa or whatever and buy a bunch and then get it at a discount and then split it. Right. So what happens is one person has to buy it, legitimately,
right.
But then resell it to another person, which that's not legal.
Right. But I guess in that situation that the reseller couldn't, or the repurchaser, I guess, couldn't go back to the original spa and say, hey, I'm having issues with this. You originally purchased it from Allergan. Can you please reach out?
They can't. Well, yeah. I mean, I guess that'd be like extra complicated.
Yeah.
Then you'd have to tell your Allergan representative,
you resold it.
I kind of gave this to someone else, or I sold this to someone else to use, and she had an issue with it.
Yeah.
I don't think they would respond very nicely to that. So I want to get into like why people buy fake Botox because, as a physician, I can buy real Botox. And in some states, nurse practitioners can also buy Botox, but other people cannot. So if you are a registered nurse or an esthetician or just somebody who wants to do this and has no license, there is no way to buy it legally. And so that's very tempting, I'm sure, to either buy it illegally by illegal importation or buy it just illegally off the internet. I do think there are probably some doctors who could buy real Botox, but don't want to pay for it because it's expensive. And maybe they do this. I don't know. They'd have to be totally nuts because as a physician, you'd have to know how risky that was. Not only, could you risk the health of your patient, you probably would lose your license if anyone ever caught you doing that. So I don't think that that's the bulk of what's happening. But it's possible that
well, I think you're right. I mean, it is a huge risk. I think you do risk losing your license as a physician. Obviously, you know better than I do. But I do think if we're being really cynical, at the heart of this is probably cost and price. And so I can see a universe where a physician will take the chance with their license and just go for it if they see something like that.
I can imagine. I was at an AmSpa meeting recently, just 2 weeks ago. That's when these headlines happened, by the way.
Oh, that must have been fun.
With the Faux-Tox. I was actually at AmSpa.
Right.
And I met a woman who lives in Vancouver, Canada, and her partner, who she established her med spa with, moved to LA and opened a med spa in LA. And she couldn't believe how expensive Botox was in the States. And so they were buying it for, less than half the price in Canada. And then, their pricing had to completely change for
LA.
Los Angeles
Yep.
because the costs are so different. I often get that, from patients who've lived in other countries and they move to Seattle. We get a lot of people moving here, like who work for Amazon, and then, you know, um, and they just can't believe how expensive it is. I'm like, yeah, it's terrible. It's not like I'm trying to gouge people, but it just costs so much just to purchase it. I think that's, I talked previously about Groupon, but that's why I just don't believe all these crazy Botox Groupons. It makes no sense. You can't do this for $8 a unit. You'll lose money. And that's if you actually kept the $8, but Groupon keeps half of that. So you would be hemorrhaging money if you really did Botox for $8 a unit. I mean, hemorrhaging it. And I have absolutely no idea. My guess is that none of those could be using Robotox. It's just not possible. That, or they're just going out of business. I don't know.
Or they're
But,
hoping that's what brings people into so it's like a loss leader, I guess.
yeah.
That could be.
And I question whether those people, end up, if you really want $8 a unit Botox, you really should get it in Canada or Mexico. That's not real here. It just doesn't happen.
Most of the cases that we deal with isn't with counterfeit. It is mostly with just kind of the illegal reselling or importation into another country. And oftentimes our litigation teams, if you ask them, like, can you pull it down? There's surprisingly not a whole heck of a lot you can do. I thought that there was more that you could do with pulling things down, whether it violated, these reseller sites' terms of service, if you're putting something on there that's illegal. And I think the reality is it does cost a lot of money to go after either counterfeiting, if you can detect it, or illegal importation. And I don't think that a lot of manufacturers, even though they should maybe put more resourcing into it, they don't often have the resourcing to deal with it.
I wonder if the solution is really about enforcement of licensing, maybe on that side, because the driving force here is practicing medicine outside of our medical system, right? So, we have all these checks and balances in the hospital and in doctors' offices because we know that we are very highly regulated and we don't want to lose our license, and we don't want, hospitals want to keep taking care of patients and, billing Medicare and billing insurance, and they don't want to be shut down or cited. And there's a lot of competition among hospitals, and the same thing for doctors. We want to be able to take care of patients. We don't want to lose our license. We take it very seriously. And this has opened up a realm of medical treatments that are completely outside the medical system. And, people who are practicing way out of the scope of their license and can't do it legally. So they're doing it illegally. So I just wonder whether regulation from the nursing board and the medical board or local legislatures that could actually, prevent people from doing this, because it's so dangerous.
Yeah. I mean, this is kind of the heart of your book, isn't it? Right? It is about...
Well, my hope, the reason we are talking is to educate consumers so that they know what to ask.
I mean, I think it's a little bit probably of what you're talking about with people practicing outside the scope of their license, but I think it's when I say your book and the topic of your book, it's this quasi medical aesthetics industry. Like, it's kind of a made up industry. It's like an aesthetics industry, and we've tacked on the word medical as if that...
Well, I would kind of say the sort of the opposite is that it's medical. It's the practice of medicine, because it is so popular and in many ways lucrative, that so many people are jumping into it without checking with a lawyer and without checking, what the rules are, and just like, oh, look, I can order
Well, but
Botox off
that's
of
but that's
the internet.
exactly what I
And
mean, is that they're not medical. Some of them aren't medical practitioners, or the practice of medicine isn't necessarily within the scope of their licensure. And we just added the word medical to this industry. And so as consumers, we believe that if it's a medical aesthetic spa, that it's run by a physician or someone who is licensed to practice medicine, and that's not always the case. So that's all I meant.
And increasingly,
Yeah.
it's rarely the
Yeah.
case. And that's, what I believe. Of course, I don't have enough data to back this up, but I believe that much of the growth in the last 10 years of this industry are people doing it illegally. I've been asked, well, if nobody's harmed, everybody's happy. What's the harm, right? What's the big deal? I'm like, well, there are plenty of people harmed. It's just, it doesn't make the headlines. And the reason we're talking today is because actually it made the headlines. but it may very well be that there are people who've gotten botulism for a long time, and it wasn't recognized. But we in medicine, we don't see real botulism anymore. That's a really, really rare thing. When would you ever see that? We got rid of botulism because we have really good canning techniques, and our food supply is really well protected, and nobody gets botulism anymore.
So
it used to be that,
what does
it would be
botulism-
like a bad can of beans or something. And, botulinum, toxin was in there, and people ate it and died because they were paralyzed. And we got rid of that. And so one of the things that the CDC, warned doctors about is, signs of botulism, because we're not used to seeing those. And it may very well be that people have had that and gone to emergency rooms, and we didn't know that it had to do with Botox.
So what does botulism look like? Is it just like really bad food poisoning with paralysis, or?
Oh, no. I mean, it's not even food poisoning. You don't get GI sick.
Oh, you don't get like feverish
it
or
paralyzes
vomiting.
you. So, it's not just that like you've got heavy eyelids, because that's, a little too much Botox in your forehead that can do that. But this basically can go to your diaphragm and paralyze your diaphragm, and you don't breathe and you die. Right.
Wow.
So it can paralyze all the muscles in your body. But the big muscle we worry about the most is the part that the muscle you need to breathe.
Yeah.
And I mean, when would doctors have seen that, right, in real life, and recognize it, right? You might have somebody having, a respiratory crisis and not recognize that it could be caused by Botox, unless the person says, oh, I just went to this weird place for Botox. So I think that it's interesting that this got caught. So I don't actually know how this was found in 9 different states, because it must have been reported by someone, maybe in an emergency room, like, oh, this person told me that they had gotten Botox in the last few days, and maybe it was a weird location or something. I don't actually know. I only know of the person in Illinois, the nurse. I don't know who all the other people are. I imagine it's going to be a really interesting unfolding story to find out who are the people who are illegally doing this.
Potentially 2 ways that this could have come. So FDA has both a reporting website for what's called an adverse event for drugs, right? If you have a bad effect from a drug, you can report an adverse event, whether you're a patient, usually a physician, I'd imagine. And then they have a counterfeiting kind of reporting site. Of course, we don't know, but I suspect probably what happened is there was adverse event reporting, because I doubt that, if you went to emergency room, the doctor was like, oh, you must have had, counterfeit Botox, versus just, oh, you're showing signs of, toxin poisoning. And then you go through the history of what you've done, and they, it's revealed that they've had Botox. And so I suspect, I'm guessing, obviously, and speculating here, that, as a physician, you'd say, oh, this patient must have had an adverse event adverse reaction to Botox. I'm going to report it. And then, then you see a trend, I guess, if you're at the FDA. I don't think that these reporters actually, or whoever reported this, kind of caught onto the counterfeit angle. And I do wonder, they must have been investigating this because somehow they've come to the conclusion that it was counterfeit Botox that these patients got.
Yeah. I mean, I wonder if it was all from the same source, the same website, or, I
could be
curious.
Yeah, me too.
But we'll find out hopefully in the coming weeks and months. So I think I would really like to just leave our listeners with some advice about just how to avoid this. And I think first of all, and I know I've said this before, but when you first go to a new place, if you haven't seen a doctor or a nurse practitioner or a PA, then that place is operating illegally. You cannot have a medical procedure without an initial workup, consultation, good faith exam, whatever you want to call it, by someone qualified to do that. So if you go to see an RN, a nurse, or an esthetician, or anybody else who maybe is in scrubs, but they don't have any qualifications, that's not legal. And chances are, if they're doing that, then they're probably cutting corners elsewhere as well. And as far as I know, this nurse in Illinois was an RN and was doing this on her own on the side. And that's not legal and really not advisable. And the only other thing that I think would be really helpful if you are going to a new place, one, confirm what toxin you're getting. So there are 5 FDA approved toxins in the United States. And I keep mentioning Botox and Dysport because those are the two that we use, but there's also 3 others: Juvo, Daxxify, and Xeomin. But you can ask to look at the vial and just say, oh, I just kind of want to see what it looks like, and just see what it says on there. It may not be possible for you to tell that that's real or not, but at least you can see what they're doing. One guy who was arrested who had been illegally injecting, if you looked at the vial when he was arrested, this was back in 2018 or 19 in Texas, the vial was labeled in Turkish. So make sure the thing's at least in English, right? And if it is Botox does have that hologram. But if you're having Dysport doesn't have a hologram on it. But those are the main things: is don't go to one of the schlocky places that can't legally buy Botox, because they're going to obviously be buying it illegally one way or the other.
I mean, those make perfect sense to me. I mean, the one other question I'd have for you is, what about pricing, right? Because we've talked about this. I mean, if you're getting a super phenomenal deal on your Botox or your other toxin injection, is that a red flag?
Well, I think so. I mean, I think in all things, you get what you pay for. Right. So, if there's a really low price, you have to wonder how the heck they're doing that.
Right.
The lowest price around here that I've ever seen was $12 a unit for Botox. I personally think that's really low because it's really hard to pay your overhead and pay your injector and all that. But maybe as a special deal, sure. And it probably varies location to location. And in some places where there's lower rent than Seattle, I imagine that the overhead in general is lower, and it may be totally reasonable to do $10 to $12 a unit. I don't know. There are also places that price it per area rather than per unit. So that can be really harder to tell whether the price is really low or not. Because if you price it by area, then it's less clear. What does that really mean? How much am I really getting? We don't do that just because it's more straightforward to price it by unit. Mm-hmm. And then, some people need a lot more than others. And so, why should they both pay the same amount? So definitely big red flag is a ridiculously low price. And I think it's very tempting for people to pay a low price for things, but it's probably not real if you're paying that lower price.
Yeah.
So ask to see the medical director, ask to see the doctor or the nurse practitioner or the PA working with the doctor. And if those people don't exist and you can't get an appointment with them, then I would definitely run in the other direction. So that's pretty much all the time we have today. Thank you so much, Becky, for being here. I think it's been really great talking with you, and I really appreciate your insights.
Thanks for having me, Kate. Always fun to talk to you about this topic.
All right, till next time.
All right.
If you have a question or a crazy story of your own that you'd like to hear on Med Spa Mayhem, contact us through our website, medspaamayhem.com, or check out our contact info in the show notes. If you learned something and like what we're doing, please tell your friends and give us a 5-star rating in your podcast app. And read the book. Med Spa Mayhem is coming out on June 11th, 2024. Pre-order now on Amazon. You can find the link to pre-order and a link to our website in the show notes. Thanks for listening. Thanks for listening to this conversation about the ins and outs of illegal Botox. If you're curious about toxin complications and more about fake Botox, take a listen to episode 3 on Botox complications and episode 4 about fake Botox and Chinese medical supplies. We'll be back on this topic as the news evolves. This has been Med Spa Mayhem with Dr. Kate D. We are so grateful you're listening, and we hope you've learned at least one fun or possibly disturbing fact today. Don't forget to subscribe and leave us a 5-star review. Oh, and read the book. Med Spa Mayhem comes out June 11th, 2024, available everywhere books are sold. You can pre-order now on Amazon. Links and more can be found in the show notes and on medspaamayhem.com.